So what really happens during a hair transplant consultation? Let's talk about this today. Most people think that the hair transplant consultation is simply being told how many grafts they need. They come in and they find that number. In reality, that represents a very small part of the overall consultation. A proper consultation needs to represent a detailed medical assessment of the patient designed to answer particularly one question: is the surgery the right option for you? Now let me show you what you should expect and what should happen during every consultation you might have. First of all, let's talk about medical history. This will be an important first step in understanding you as a patient altogether. We'll discuss your general health, medications that you're taking, previous surgeries, any allergies, smoking, medical conditions that could affect surgery or the healing phase and the recovery process. Hair transplantation, after all, is a surgical and a medical procedure, so your overall health is just as important as your hair. Even more important, I would say. Second, we need to discuss family history of hair loss. Hair loss often follows a family history and the family pattern of hair loss. I'll ask questions about your father, brothers, uncles, maternal relatives to help estimate how your hair loss may progress over time. This might or it might not be valid for your case. This will, however, allow us to plan not just for today, but for many years ahead. Third, hair loss progression. How did you first notice and when did you first notice your hair loss? Has it been a gradual process with a sudden onset or a rapid evolving process? Has it stabilized? Have you used any treatments, let's say such as finasteride, dutasteride, minoxidil? Have you had PRP treatments? Understanding how your hair loss is evolving is essential before even considering surgery. Donor area assessment. This will definitely need to be determined. I need to examine your donor area. This is your lifetime supply of what we call transplantable hair. I need to assess the density of the donor area, the hair caliber, the texture, the color, scalp characteristics, elasticity, signs of miniaturization in the donor area, previous surgery, scarring, any other lesions that might affect graft harvesting. Your donor area will determine what can realistically be achievable for your individual case. The recipient area assessment. We then need to assess the area that you would like to be restored. Is this the hairline, the temples, the frontal third, the crown, or the mid-scalp, a combination of all these areas? Every individual area has, let's say, different priorities and will require a different strategy. What is the hairline design? Designing a hairline isn't about making it as low, as straighter as possible. This is quite often a mistake and a big one and a difficult one to repair. The hairline design should be about creating something that will be suitable for your face, for your age, for the likely future pattern of hair loss that we are predicting. A natural hairline should still look appropriate 10, 20 years from now. Estimating graft requirements, more or less with a margin of error. It can always be a little more or a little less. Only after completing the examination can we estimate how many grafts might be needed. And this is not simply a number, it should be more or less considered as a guideline. It's a balance between available donor area, area that needs coverage, the desired density, and long-term donor area preservation. Discussions about medical treatment. Not every patient needs surgery immediately. Sometimes medication might be indicated to stabilize ongoing hair loss, or in other cases, combining medical treatment with surgical procedures for the best long-term result. Occasionally, I will recommend delaying the surgery altogether. Next will come the surgical planning. If we decide the surgery is appropriate for your case, we will discuss the techniques available, realistic expectations, recovery, possible risks and complications, long-term planning, and what results you can reasonably expect. The aim is that you leave the clinic, the consultation, being fully informed and able to make an informed decision after that essential cooling off period, after seeking perhaps other consults, second opinions, and not simply booking in. Questions that I think you should always ask before making any informed decision. Every patient should ask: will you be the one performing my procedure? Am I a suitable candidate? Is my hair loss stable? What happens if I continue to lose hair? What are the risks? Do I have any alternatives to the surgical procedure? What results can I realistically expect in 1, 5, 10 years? And if these questions aren't answered, that means the consultation isn't complete. A good consultation should never be about selling surgery. It should be about understanding your hair loss, about protecting your donor area for the long term, and creating a long-term plan that will be right for you. Because good hair transplants don't just begin in the operating theater, and they begin with an honest conversation long before that, during the consultation process.